everyone. My name is Sharon Secondus. Sharon is fine. I know we're supposed to be in person together in Atlanta, which is where I reside. It is sunny here, really hot. So I don't know if you like the temperatures really high. It's really hot out here, but I'm sure, in the comforts of your homes and offices, you're being cooled off out there. Again, so lovely, so happy to be here to talk you through that I've been working on and get to hear from other speakers as well and connect with you all. It's absolutely a pleasure. So let's get into a little bit about me. As I said, my name is Sharon, and I currently work as a senior healthcare business intelligence analyst at McKesson. I'll pause there to say I'm someone who's absolutely passionate about healthcare data. And as I will go further to tell you a little bit about my background, you would see how that really plays in as well. In my educational background, I did my undergrad in software engineering in England, did my first master's in Warwick University, cognitive systems, which I'll tell you a little bit more about how I took the journey from an absolutely STEM background of software engineering and then finding myself in healthcare, which I absolutely love, where I did my second master's at University of Massachusetts. Of course, they say, all work, no play makes Jack. You know the saying. I do enjoy taking walks. I do cooking. I love traveling as well. And a little bit of fun fact about me. As I would share my passion in healthcare is that I have experienced healthcare in Africa, in the continent of Africa, in Europe, in US as well. And outside of working, hobbies and all of that, I do run a small company called See Me Now 33, and where I just really help students to transition from that student space into the corporate background, into the corporate world or professional world. So again, please feel free to pop in questions, at any given point, and Theo will help me to fix that as we go through. Okay, so today we're going to get into obviously journey mapping of the cultural experience in maternal health, which is what I really am here to cover. But I do again want you to get to know me, get to know the why, get to know my experience and even how I came into UX, which I have very interesting. Well, I do say it's interesting, but I want to explain the story to you on how I got into UX as well, and how I have been utilizing UX even in my current role as well. So in terms of my education, as I said earlier, I really came from that software engineering background. I was very certain that I wanted, I was really aiming for the Google or the Amazon and really going in that background of coding and all of that good stuff, which is still helpful till today. I was certain that that's the background that I wanted to go in. In fact, I was building, UIs in that space already, but I didn't have too much of like that user experience background. I had some knowledge, when we would go through like the waterfall, life cycle and stuff like that. I had a little bit of experience with that. And then eventually I, having loved ones, friends, really get into that healthcare space, getting into the stories and connecting it personally for me, it was that my mom used to work in the hospital when I lived in Nigeria. So I had a personal connection to that. And the first thing is that I knew I did not want to be a provider. I know nobody would like a provider to treat them that is scared of blood or that faints at the sight of blood. So I knew that that was a path that I didn't want to take. So I started thinking about how I can really bring in those software engineering skills into healthcare. So initially, after my undergraduate degree, I decided to take a first master's in cognitive systems at Warwick University. And that got me a little bit into more of like the psychology parts and just start working with the types of data out there. And, I think after that, I was like, okay, this is interesting, but it's not really what I want. And then I started to research, how can I really come from that IT and bring it into healthcare, but not limit myself as well. And that's where I found the degree in health informatics, and I was like, this is it. I am moving to America to start my new life and really get into uh, healthcare data, health informatics, and really bring in those skills to really close that gap. I would say this, it was very fulfilling for me. And as someone, who wants to utilize the IT skills or technology skills, it was very important for me to still have that fulfillment. So, as I like to say, I like to think about it this way. If you think of a triangle, and on each point, you have cost, quality, access, and data right in the middle of that triangle. So, depending on how you work with the data, how you pull the insights, how you use it to make evidence based decisions, strategy, finances, you can really help the three Ps. And I like to call the three Ps the patient, the payer, and the providers. So depending on how you work with the data, you're helping the patients, really improve the access, improve quality, possibly reduce cost. I know that's one that, can be very tricky. So depending on how you work with the data, you can really impact, the payers, the providers, give them more time to really focus on the patients, increase patient experience and all of that good stuff. So coming from that health informatics background, I started working as a healthcare specialist, and really I started out in healthcare claims, which is one that has a lot and lots of data. Can be messy, usually incomplete. If anyone who's worked with healthcare data, I started in that space and transitioned into EHR, and now I'm in the oncology space, where I get to also work with, oncology, EHR data, pharmacy data, demographic, SDOH, which is the social determinants of health data, third-party referral data, and, just really creating stakeholder products they can use to make decisions. Now, I'll pause a little bit. I'm going to tell you how I got into UX. So coming from that very pure STEM background, which I'm coding and in Python, in SQL, in R, and all of that good stuff, which is absolutely still great, which I still use till today. I I got so used to it that it was very logical for me, and it was nice. I did find the creativity in it when there would be a coding problem where you would have to solve, which was great. But then, through that solving process, you get to really, release some creative juices. And, when you get so excited, when you finally solve that issue, coding issue and stuff. In that time frame, my brain was really ones and zeros like a computer. And I really got to enjoy that, expand and have all the experiences with that. And then, I got to hear about user experience. And one of the things I started doing was to go out to LinkedIn, which is my preferred social media outlet. I went on social media, I went on, sorry, LinkedIn, and I started reaching out to people and saying, hey, you're a UX experience designer. What does that mean? You're in UI, you're a user researcher. What does that mean? And they started telling me, like, I think it means this. It means this is how I'm applying it at my job. This is how I'm applying it at my role. So getting to understand that, I really felt, okay, I think this is something I need to try. This is something I need to put, some interest in. So I did a boot camp, a UI UX boot camp, and I really, really enjoyed it. It really did open that creative aspect of my brain. And I'm sure maybe loads of you or people getting into UX feel this way. I don't know, but for me, really coming from that very logical way of working, it really did shift something for me. So I did the boot camp. I absolutely enjoyed it, got the experience from it, got a community from it as well. And I started also applying that in my work. In my line of work, I do build a lot of products. dashboards for leadership, for people to make decisions from, for doctors, for practices to make decisions off of as well. So I started applying, the UX principles into how I would design these dashboards or products, and really make sure that I'm not now just having that very one perspective view. For example, like where the data will tell you, oh, this is going up. You have to take the word of the data. It's going up, and everybody has to take it that the data is going up. So I started to take on that aspect. And as I built the products, I really made sure that I was utilizing the UX principles, and just looking at things such as like filters, seeing how people got insights really quickly, getting feedback as well to see how that's also changing between the stakeholders as well. So I would say I'm still in that phase where I'm always trying to push that creativity and actually balance out that logical aspect of still being able to code and solve the problems and review the data and all of that, and using that creative side to really, marry how I can now present results. I would say one thing that really stood out to me once I started adapting this mindset of marrying the logical with the creativity was it really helped me to present my stories in a very different way when I was talking to leadership or getting insights, which was very beneficial for my role. So that's my story on how I got into UX, or made that space of just following the path from logical to the creativity. Okay, so now I really, as I said, I built a community, from the boot camp that I had, talking to people, talking to even the healthcare UX people. Now, one thing I noticed that when I would go to like LinkedIn, try to connect with people, which they were very, I was very happy about. People were like willing to connect, have like a 5-minute chat, a 15-minute chat, just to tell me a little bit about their experience. I noticed that there was still a gap, right? I noticed that some people were using it differently, in their, depending on the kind of roles they were doing. But I decided that I was going to create like a community where I could ask questions, where I could know what people are doing, and I noticed that when I noticed the UX healthcare event, I told everyone, I was like, hey, I think this is going to be absolutely amazing. We need to, increase how, people come to this event or this conference, and just really put the word out there. For me, I've always been passionate about maternal healthcare. In fact, May is Maternal Mental Month. So, looking through mental experiences in the maternal health community or space. So, for me, just having that passion and also picking a mentor from the UX community I had built, I started to do some research and really see. And I think, anyone who lives in America, you may have heard, like in the news, you may have heard, on Instagram, or I hope hopefully sometimes it gets very gory on TikTok. If you hear some of these of the stories where they say, out of a certain sample set of pregnant women, you know they're likely to die, there's this number attached to it. Sometimes we do hear that that maternal mortality rate is going down, but there's still some gaps that really still occur, where we want to be able to close or bring it in just a little bit more. And I will say this, I'm not going to solve that all by myself. I think this is a really collaborative and collective effort, and it's not even just the providers that are only going to solve this issue. I think it's definitely a collective effort of the technology, the types of data sets, the experiences of the people who are pregnant, have been pregnant, experiencing pre-pregnancy, postpartum, and in between. So we do need their experience as well to be able to, bring all of that combined together and really, really see how we can close the gap. So, that's the why for me. I mean, there was a very huge campaign, which, a lot of the work I did here was really based on. So it's the CDC Hear Her campaign. And it's really gave the video experience of women talking about their experiences, pre-pregnancy, during pregnancy, and after pregnancy as well, and just explaining their stories. Right here, I've put some, excuse me, I've put some facts on, how that maternal mortality rate is really affecting people. I'll move on now. When I do say the cultural experience, I know sometimes it's very easy to just think about, oh, okay, it's race, black, white, Asian, Hispanic. No. So I do want to give a different perspective, because that cultural experience, it, yes, has some effect on a certain ethnic group, where they experience some things a little bit different from a different ethnic group. In fact, some of the papers from CDC and NIH really show that people of color have a different experience from uh, people who are white in terms of that maternal health experience, through pregnancy and postpartum as well. But here, I really wanted to focus on, hey, how can we close the gap on really bringing in the emotional, the physical, the mental, the socioeconomic, which are really huge factors that can really transform the experience of a mother or transitioning into motherhood. I think going through the Hear Her Now campaign, there were combinations of this. It's not just that one person had like an emotional, factor or issue or cultural experience. It could be a mixture of physical and mental, socioeconomic and emotional, or all four together and more. So from that standpoint, I believe if we are looking at it this way, it can help, and not just help one class of ethnic people. The plan is to close that gap for everyone. We do want a space where people transitioning into motherhood, after motherhood, they do have an experience that is good. If I should say, I'm not a mother myself, but if I should say, have a good experience, or have an experience that feels like it fulfills needs and fulfills the right needs for them as well. So I just wanted to put that out there. Also, for this project, I really utilized the Hear Her Now campaign. I built some agents utilizing AI to really help me through the video processing and of each individual woman that gave her experience or story on her maternal health journey, if I should say. I used AI to build some agents. I looked through some articles, used some secondary data from CDC to really bring in the story for me to see, where does the gap lie, and what are some things to consider. And that's why I came up with the factors that influence. Okay, so for me, this bringing this application into maternal health, I started with empathy mapping, creating the personas, journey mapping, and obviously looking at in the transition, or my next steps is designing better experiences, or how can we start to look into better experiences, because I think that's what's really going to help in terms of that cultural experience. And I'll also say this as well. When I say cultural experience, again, please don't only assimilate it to ethnic groups or people that look a little bit different from you as well. So just a very quick overview here. In terms of the maternal health journey, and this is a diagram from HIMSS, an article that they had looked into as well, which is great, but it does cover that very straight view from a provider standpoint, which is also needed. Again, this is not to negate what the provider brings. As I said, it's a very collective effort. So the technology, the provider, the patient, everybody needs to be involved to really close that gap again, which I'll go through as I go further in the presentation. So obviously transitioning from preconception to the 40 weeks after birth. And as most people will say, like, after the 6-week checkup, it's like crickets, right? And this journey here really just gives us that very provider perspective view, which is also good. But we start to see those gaps where, hey, what about the emotional experience? What about the physical health? What if the mother got some illness throughout the pregnancy, or got some form of like illness too after the pregnancy? How does that affect things? And yes, we do have to bring in race as well, but that's not our primary focus as well. And then lastly, socioeconomic, depending on where you live, depending on um, your lifestyle circumstances, it can drastically affect this journey of pregnancy for any mother. Um, Again, there was another one by Bendigo Health as well, which had a journey map, again, still that very provider focused view, which again, as I say, it's still very great. We do need this. Again, it's still a very collective process that we all have to go through to really come together. And this journey map, it's great. It shows like different points in, when the mother and the baby, and again, it comes down to the 6-week checkup, and everybody goes crickets again, goes silent. And I think there's a lot of missed opportunities there, and where technology can come in, where people can start to find the right resource for the issues, if it's mental, if it's emotional, if it's socioeconomic, because sometimes it's not everyone who plans all the way to the 6 weeks, or all the way to the first year of the baby, but we need to take into account how that shifts as well. Okay. So as again, I said, I use an AI agent to really look into the stories of the Hear Her Now campaign, using some secondary data, using some articles, which I am going to share the resources and reference of the articles I used at the end. I'm a typical student. I always remember to share that. So I started looking and classifying some things in terms of physical, mental, socioeconomic experience. One of the things I found was experience. This was one where a lot of women expressed, just hearing how, they had to take the stories of other women to really understand their risk. Um, which I feel there's still a huge gap in that, which I feel, health literacy can try to close as well, in terms of, again, trusting providers as well, um, how that affects their experience as well. We do have that space of mixed information overload, the self advocacy. Of course, in America, especially now, the health rules and laws, how that can dictate things. If you want to get pregnant, if you want to transition into motherhood, especially based on where you are right now. I did see that experience of mental health, just talking about their lifestyle factors, postpartum recovery, getting the support they have, anxiety, and then transition into socioeconomic, where, of course, finances is such a huge thing, the environmental factors, again, socioeconomic, really standing for that policy and advocacy, and then access to healthcare, which can be drastically different for people, depending on where they live, depending on their circumstances, depending on what they can afford as well. We do see health literacy here as well. And then taking it to the end here on the green side, we do have the physical. So in terms of physical, which is like, physical health, in terms of, they've had reproductive issues, lifestyle factors, again, age is a concern as well, unexpected health issues, pre-existing conditions, and then access to the different provider specialties. So if someone has, as someone mentioned that she had a life-threatening illness, but she was still pregnant. So how does that access to, really getting that collaborative efforts between all the providers involved that are going to transition this mother now from the illness, or manage the illness and still manage the pregnancy and still have a healthy pregnancy and have a healthy baby. So there's a lot to consider here. And again, as I said, one of them that really stood out for me is just really that experience, and how each woman was really, thinking about it and, hearing the story of other people, and then now thinking, okay, where does my risk stand, and where do I have to, think about things. And then with that, I was able to get into some empathy mapping and just really looking at, again, what were they hearing? What were they thinking about? What kind of books were they reading? And I think what was really important for me, and as well with my mentor working with me on this project, was really, trying to just classify the pre-pregnancy and post-pregnancy. Now, there is that in between. There is that in between, but I think with that in between, as someone, I would have loved to, partake in some interviews and talk to some providers and talk to some people who are about to be mothers and all of that in between. But I know that this is not easy for everyone to really, share their story through interview, or really even give some information as well. I know it's very bold of the women that participated in the Hear Her campaign, or even the people that you talk to every day who are able to just share their story and share their experiences as well. So I decided to just keep it really pre-pregnancy and post-pregnancy as well. In the pre-pregnancy stage, there was a lot of that excitement, getting into motherhood. This is something I've wanted. This is something I've been thinking about. And then, I believe that's where that influx of information comes through, where, they're going to people, hey, what do you think about this? What do you think about that? Hey, do you think I should freeze my eggs now? Do you think I should go, talk to my doctor, and all of that? And, that excitement of getting into motherhood really takes, a huge chunk here. And of course, it's different for everyone in terms of, depending on their financial background, their socioeconomic, just getting access to the right healthcare for them, and then health literacy as well, which I try to highlight throughout this as well, which I feel like it's such a huge aspect. That's every given point. Again, just thinking through the support system in that very pre-pregnancy stage, and just really understanding, hey, how do I make the transitions, and not just think about the now, but like later, how do I make sure I pick the right OB? How do I make sure, if I have the illness of, dot, 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 how do I make sure I get all my providers to be on one page so that I can have a healthy pregnancy, and make sure that I'm able to deliver my baby and my baby is going to get out healthy. So these are some things they really considered and were worried about in terms of pre-pregnancy. One that stood out for me is, the resources as well, right? So in the pre-pregnancy, with that information overload and influx, and reading all the books and trying to ask the doctor 50 billion questions, and all of that, I think there's that space of, how do I balance what's right for me? And when we start to speak about self-advocacy, which I experienced a lot, which a lot of the women experienced a lot in terms of the Hear Her campaign, when they would talk about their stories, it's very interesting that the women now speak about self-advocacy, especially before pregnancy, not just, while you're pregnant or after you're pregnant, or even while you're delivering your baby. They speak about it now, and just, telling people like, hey, you need to understand what's right for you, and just saying, hey, you need to advocate for yourself. So now we transition to post-pregnancy. I did see that, through the Hear Her Now campaign, some of the things they were worried about, or the pains, was, hey, how can I make sure I'm accessing the right postpartum care for me? Some of the things they were saying was like, I was having some pain, I was feeling this, but I kept being told it was normal. So that space of reconciling, hey, I'm not really feeling good, I am speaking to my doctor, how do I find that common ground of, really getting down to how I want to feel like myself, or feel in my body like myself again. So some of the things, they would hear is, hey, are you resting well and stuff? Have you gone for a 6-week appointment? Why don't you just ask your doctor? Sometimes, that why don't you just ask your doctor is, it starts to create some level of mistrust, which I did see from, I was able to corroborate from the videos of the women talking about their experiences as well. Um, and in terms of what these women do in that post-pregnancy state, they try to find a community, trying to get themselves back, read books, try to utilize some, apps, try to really see what the stories of other women, again, that experience comes through in terms of just, hearing the experience of another woman to really say, okay, how can I put myself in her shoes in terms of maybe I don't have to go through this since this person has gone through it. So maybe I can take some, marks or take some notes from her books as well to be able to get myself back. Okay, so now we transition to the personas. So again, I really tried to keep it between just pre-pregnancy and post-pregnancy. I'm in no way demeaning that there is not that in-between space of the pre-pregnancy, or sometimes it doesn't even get to post-pregnancy for different people's stories. But I really tried to keep it between those two for now. So we do have in pre-pregnancy Jane, who's excited, nervous, about to get into motherhood, is excited, wants to know about the resources that's going to work for her and work for, the kind of pregnancy she's about to have. And then we do have in post-pregnancy Jules, who's, already had a baby, but then in the second pregnancy now is feeling like, hey, things don't feel right. Like the first time, things are a little bit off. And I don't know if it's normal. I don't know if I'm reaching out to my doctor in the right way. Is it just me? Am I thinking about this right? Should I just wait it out, or what am I supposed to do here? So in these two stories, we do have, very specific things going on, but then I do see that common ground of health literacy, which I felt like it's a very important aspect. Going through the journey mapping, that's something I kept, and I felt like it can really try to close the gap on certain things, not everything, but on certain things, it can really help to close the gap. Okay, so starting my journey mapping here, I really took it on and called it the pillars of maternal health. I'm sure some providers may see this and say, no, not exactly. But in terms of just, again, bringing that cultural experience from that standpoint, just calling it the pillars of maternal health. So I did have here physical, emotional, mental, and socioeconomic, and really combining these three. I called it the combination. Again, as I said earlier, some people's journeys, it's not just like maybe having one, it can be having none of the issues, but there is that space where combination exists, right? And so I started to create the journey mapping and saying, hey, at a given point, you can have the orange or the blue or the purple or the teal. How about that combination? Where does they exist? Or how about if you have a little bit of two or just a little bit of all four of them? So I started to keep that in mind through as I created that cultural experience for the maternal health. Okay. I'm sure if a provider sees this, they're going to say, hey, this is not this is not what it's all about. And I definitely understand. I just wanted to take this again from that very cultural experience. Again, not just focusing on ethnic groups as the main point of having a cultural experience. As you can see here in the first trimester, I did put race. Now, I put race because some of the articles and some of the papers that I have read, there was a disparity, right? So that disparity, if we can look at certain things like, the percentage of women that are likely to have, for example, preeclampsia, or likely to have some, postpartum psychosis and etc. It may help us to catch some things. As I shared earlier in the slide deck, there was a lady that, one of the articles said, hey, reason why the maternal mortality rate is high is that some of the things can be preventable. And I think coming from that preventable standpoint, it's very important to also consider those who, have that disparity of where, it's being affected a little bit more than some other ethnic groups. So I did have race here as a standpoint to check, to say, okay, what's going on? How is there anything we should be looking at to kind of prevent as well? I do have here, the physical, the mental, the combination as well. In the first trimester, as I said, that excitement is really there. You know, to that excitement of getting into motherhood is there, and as they begin to make that transition of conceiving, transition from PCP to your OB, where they need multiple providers. And I did highlight health literacy here, and I do have technology in that first trimester, and something that goes throughout the journey as well. I believe this is the place where we can begin to close some of those pain points in terms of using technology, and I'll get into that towards the end. There's a lot technology can do for us. There's a lot AI can do. I know it's a very interesting subject when we start to bring AI into healthcare. I believe there's a lot technology can do for each stage to really help to start to close that gap. And I'll share some companies as well that are also helping in terms of closing that gap towards the end. But I added here, those pillars of maternal health to really help shape and to really see where that intervention can go. In my mind, as someone who works a lot with data and someone who, does predictive modeling as well, if there's, I think about in terms of the data. So if I have a huge data set and I already have done a quality quality audit, QA analysis, EDA on the data, I can start to, do some predictive analysis to kind of see how things are going and say, hey, if I have the next data set, this is how, I predict, for example, lung cancer is going to be, or breast cancer is going to be, or in this area, there's, this kind of treatment and so on. So in my brain, I, really dropped in those pillars and said, hey, if the first trimester can tell a story, right? How's the second trimester or the third trimester, or does it point us to that postpartum where now we should not just stay in the 6-week checkup point? We should stay after the 6-week checkup point to kind of make sure things are going well, or things are being contained, if I should say, in the maternal health journey, or the cultural experience of the maternal health journey. Again, in that first trimester, you do see that information overload. So everyone is telling you, hey, you need to go to Dr. A or Dr. B, or you need to make sure you go see your doctor every 5 weeks or something. People too are telling you their stories. Oh, I had this experience and I had that experience. I didn't trust my doctor. Oh, don't vaccinate your child. There's a lot to think about. And in that excitement, there's that a bit of anxiety as well that must be contained in terms of, hey, how do I start to make the right decision for me? Health literacy comes in so that you make the right decision for you and not based on stories. Now, there's a place where experience does help. There is a place where experience does give some pointers, but it shouldn't be the reason why you make some decisions. So quickly here, I'm going to transition to second trimester. In that second trimester, we do have, from the provider standpoint, that viability week, fetal movement, all of the things the provider expects in second trimester. Going on. Again, I do have technology here, which is very beneficial. I do have health literacy here as well. Again, things like socioeconomic, can really affect, we don't know how, if you know how the patient's lifestyle is, these are some things, you make sure you're communicating with your patients and just really seeing that they stay within that health literacy. And then as we transition to third trimester, again, we do still have these pillars of the maternal health and technology again, and literacy again coming in. This is a very important aspect now. So you're making the birthing plan, the baby is being delivered, transition from, the OB, the 6 week checkup, and things to consider as well. And then obviously this is where a lot of emotions, this is where a lot of mental health, or even some physical issues may now fall back, because now you've delivered your baby. So now it's time to, you know, heal from, the pregnancy, but still deal with your other chronic illnesses as well. So there's that combination of, that excitement and the joy that comes with the baby. There's that exhaustion. There's that, anxiety of, am I going to be able to, you know, get better to be able to care for my baby? Do I have the right community and all of that? So I do have all those pillars there. And, this is somewhere technology can come in. Again, health literacy, and then finding the right resources for the person. Now, I do understand that when you start to look at this, there is that space of bio individuality that comes in where, every person's story can be a little bit different, right? And that's why I say we need to still be collecting data and really, start to create that sample size, right? And really be able to take those sample size of, people that, have this illness, which I believe there's a few articles that I did see focusing on certain aspects of preeclampsia, certain life-threatening illnesses as well for people that were pregnant as well. But I do believe there's still that space of where that, patient experience comes in to really help give a little bit more insight as well. Again, this is a collective effort. This is something that the providers, the agencies, this is where the data, the experience and technology comes in to really close in that gap. And then finally, going to post-pregnancy. Again, this is, that fourth trimester, as some people like to call it, the 6 week appointment happens, they give them the postpartum questionnaire. Hey, how are you feeling? And, all of that good stuff. Do you think you have support? And all of that good stuff, which is great. I think there's still, some missed opportunities there where, you can really capture some things to really help facilitate or help intervene in terms of certain postpartum illnesses or worries. And I think health literacy can really come in again to really help with closing a little bit of that gap. And then usually most people were saying in their videos was like, oh, after the six week checkup, like that was it. It was crickets. I didn't really hear anything. And you begin to see that communication gap close, right? And we do want that space where it's open. And I think technology can really come in to help, in that communication gap, because you want to be able to still say, hey, how are you feeling? From what I understood from, one of the lady stories was that, it wasn't like it took almost a year to really get out of that postpartum. And I'm sure it's different for everyone. And, depending on, again, on the pillars, depending on if they have some mental issues, emotional, socioeconomic, physical, or a combination of all of this, postpartum doesn't just end at the 6 week checkup. And I believe this is where sometimes mistrust can happen. I believe this is where there's some missed opportunity. I also believe that this is where some information influx takes place as well. We start to see where there is people are like, researching some form of information to kind of see if they can feel better, researching some kind of information to see, how do I get the right resource? Do I need a doula? Do I need to, talk to maybe not my PCP at this point? How do I make sure that, I'm being seen, I'm being heard? This is one of the things one of the ladies mentioned, like, how am I making sure that I'm being seen, I'm being heard, and my doctor is not just dismissing it as this is a normal part of the process. So with their stories and using some secondary data, this is how I came up with the cultural experience for journey mapping. I know I'm running on time very quickly. I'm almost done. I think, again, as I said, it's not just one person that solves, that gap that, that really is there for that maternal experience. I think there's still room to bring that in. And I think it's a continuous and collective effort. And I think it can really bring about improved quality, improvement, patient experience. Again, as I said earlier, more data. I know that's something in healthcare that everyone is like, we just keep getting data and data and data. And I'm biased because I do enjoy working with healthcare data. So I am biased about when I say more data. Again, here with the patient experience. And then one that really stuck out for me as someone who's in the healthcare space or just, working with AI, doing a little bit of machine learning, is AI and gamification. Um, if you saw during, that space of like first trimester, third trimester, I do have technology, right, at every given stage. And I believe technology can really help to close some of this gap. Um, I believe there's room for AI to synthesize some of this data, analyze some of this data as well. I do believe there's a space where we can start to, help make even the health literacy efficient, effective, and really help make that health literacy enjoyable as well. Because, as I said, and as we saw in the first trimester to like after, there's a mix of emotions and all of that, and then there's that information influx and overload and all of that, and everyone's telling you what you should do with your body and what you shouldn't do and stuff like that. So I feel like there is a space where gamification can come in to really help in terms of that technology. Right here on the right side, I did highlight some companies or startups, if I should say, that are really into closing some of this gap. So we do have Millie, where they're, not just looking at the experience of, hey, come in for your blood work, your baby's okay, leave and come back on this day to give birth. They're looking at it from a very holistic standpoint of, really covering some of those four pillars that, I talked about earlier, and just making sure, hey, how do we make sure, that transition into motherhood is you have an experience that works for you and works for your physical health, works for your mental, socioeconomic, and stuff like that. We do have Maven is one that's very specific to the ethnic disparity, really closing that gap to provide a lot of resources for the Black maternal experience. Again, as I really highlighted, the Hear Her Now campaign was a big one by CDC, and just giving women the opportunity to speak on their stories. We do have Canopy, Mommy is one of them, Neuroflow is one of them, really covering the aspect of the brain and that mental aspect for pregnant women. There's a few out there that are doing the work of really bringing in the gap. Of course, the agencies, which is the Agency of Health Research and Quality, which is one I'm part of. I know last year they started looking into working on the survey for mothers, after they give birth, and really starting to have a case study in a couple of university health system hospitals. I know CDC used to have quite a bit of case studies out in hospitals. We do know the case with CDC right now in Atlanta. CDC is in Atlanta. The HQ is in Atlanta. So we do know that there's some hiccups with that right now. But hopefully it doesn't take away from the good research and the data that they've gathered to really help to, put scorecards out there, for hospitals, for health systems, community clinics and hospitals, to make sure, continuous improvement and quality standards are being met, to really bring in some of this gap. I think that's all that I have. I think for me, next steps is the quest continues. As I said earlier, it's not just me who's going to close the gap. It's not just you who's going to close the gap. I think, as I said, it's a very continuous and collective effort by providers, technology, agencies, people that collect data, hearing the patient experience, building that sample data sets for the possibilities, and using AI as well, as much as we can, of course, in an ethical manner, to really help with some of those data sets. In terms of this, I'm putting myself out there to work with the research quality agency to really see how I can, from things I've learned, like really have an impact in terms of that questionnaire that they put out to women, the case studies that are taking place in the health systems for a certain time. So it's just to continue to put myself out there and really drive the passion that I have for maternal health. And yeah, and thank you. These are the references. As I said, I can definitely share this deck with anyone who wants to have this deck, but it's such an amazing experience to be able to share this project with everyone. And yeah, I look forward to the questions. Please feel free to connect with me on LinkedIn, or if you want to have a chat, or I'm very much open to that. So thank you. Theo, can you hear me? Theo, can you hear me? Let me see. Okay. I will try to take some questions as they come up. What cultural taboos, stigmas emerge barriers to care? Yeah, I think in terms of the cultural taboos or stigmas emerged as barriers to care, I think it's definitely, there's actually a lot of them, but I would say one that really always stood out was the women always talking about mistrust, right? And not being heard and not being seen. I think that there's definitely that space of health literacy. And I think there's definitely that space of empathy. And I think there's definitely that space of communication, right? Um, I think there's a space where the providers and the patients need to have that seamless space of communication, of just being able to speak, being able to talk about their journeys, and really try to move away from the very linear, week 1 to week 40 and then 6-week appointment standpoint. Yeah, yeah. But yeah, there's a lot of opportunities that I feel technology and just still going back to our human interaction space and going back to the space where we can really engage with one another and like really feel heard and seen. I think there's opportunity for that too. Yeah.
Sharon, I don't know if you can hear me now.
Yes, I can hear you now.
Oh, perfect. I don't know what's going on. Thank you so much for that. I don't know if you answered the question that Paris had. Um,
No, I didn't see that one.
okay, let me just reopen it again. Um, so Paris had the question: whose responsibility do you think it is to own the patient experience within the maternity space? Is it the primary provider, the patient, the caregiver, or
Okay.
these supplemental service providers?
Okay. I do that. I think it's definitely a collective journey, right? I think that patient experience, again, it's a patient to own their journey, right? And again, through the, synthesizing of the data or just even the videos, it's the women sharing their stories and how it's affected them and how they're speaking on their journey. And I think they need, they own that, and that's why they can come out to express their stories. I think that a company like Savvy Cooperative, they're very good at really gathering that patient experience on different kinds of illnesses, different kinds of diseases, pregnancies, and different aspects in healthcare. And they're able to use that to really help other organizations that want to build resources and solutions to really say, hey, we do have a good sample size of experience. How do you want to use this to, create your solution or create that MVP to really say, hey, I'm closing the gap or I'm bringing the solution to that resource. Also, I think sometimes there's that space where providers may not necessarily care about patient experience. And I think that's something where, as someone who's now in, has taken the health, the UX course and all of that, that's something I try to bring into my data, especially working in the healthcare spaces, sometimes analyzing my data with empathy, right? And I think that's that space sometimes we need, right? So I believe it's a collective effort, and I think there is a space for the patient to tell their story. There's a space for where the story can be used for solutions. I think there's definitely a space for where the stories can be used to also educate providers as well. Yeah.
Oh, great. Thanks for that. Brian had another question here, which is popping up. I don't know if you'll be able to see it.
Okay, I can see. What are the most significant barriers preventing effective integration of AI in healthcare, particularly regarding interpretability, regulatory trust, and when can, I think you cut off. Um, okay, the question cuts off, but I think the bulk of the question, what's the most significant barriers for preventing AI in healthcare? There is someone I really enjoy her conferences. She's also based in Atlanta when it comes to AI. I think from what I've seen is that a lot of organizations are also wanting to be careful because there's that space of HIPAA charges, which I'm sure no organization or hospital absolutely wants charges from that. I think there's also that space of um, training the models, right? It's you have to train the agent, the model, to be able to say, hey, this is how I want to use the data. I think obviously there's that concern of privacy. I think the most significant one is just that ethical space, right? The ethical space of, hey, are we doing this right? Are we, also like removing the human factor? I mean, this is healthcare. I mean, not everybody may be comfortable using a robot to do like a brain surgery, which it's already happening, but not everybody may want that. So I think there are some barriers. I think definitely in the space of privacy, which is really huge. And I think that regulatory space of like policies and all of that is really huge and set sometimes as a barrier for AI in healthcare. I'm happy to send out anyone who wants to connect. There's a friend of mine on LinkedIn who absolutely gives talks all over Georgia about this, and she would be able to like answer this, in a very clean and concise way. Yeah.